warm up is where the race starts. Actually, you are literally fighting with the pain. You can get injury anywhere. People
Okay.
get migraine also because of this.
Really?
Yeah, stimulation of the migraine.
Yeah, because there's that euphoria when you're running and
You just want to
you
finish your race.
yeah, and you feel that it's okay, it's something minor, but it shouldn't end up in something major. So these are the signs to look out for.
These people were severely fainted or to be taken to the hospital. So
Right.
because they have not listened to that body.
Runners do experience, cramps during mid-race. What is the effective way to handle this? Should it be stretched or some different technique should be used or yeah.
The ideal is every mile you have to check your posture whether you're running in a right posture.
Oh wow.
This way, then it will not make you much tired. We always strengthen the bigger muscles like quads
Correct.
and all the. I'm pretty
Correct.
sure every runner is strengthening all these big muscles. Feet muscle. This is the most used muscle in running. Marathon running is an extreme sport.
Yes.
It's compulsory to check your feet. If you are
Wow.
a little flat feet or pronated feet, you are not taken in the army.
Oh, really?
That is the importance.
Oh wow.
Because it's your calf which is taking you till the end. What happens is eventually, slowly, the calf starts getting in the buildup of lactic acid.
There was a study which said that if you continue to wear the compression socks or the cuff sleeves, it will, help you for the recovery as well, much better than if you hadn't worn them.
After crossing the finish line, what most runners do is, stopping immediately.
Few tips on running uphill and downhill. Hyderabad has a lot of uphill and downhill running.
If you are planning to do this sport for longer run in your life, okay, then you cannot stop it. Use the calf sleeve, or you can use the below knee stocking, which is a full sock until the ankle.
Yes.
Okay, which helps you in plantar fasciitis, your heel pain, and also your calf buildup.
Hello, everybody, and welcome to our webinar called Sorgen Wellness Strides. This is a webinar specially for the Mumbai Marathon edition, and it is specially curated for runners like you and for the Sorgen running community. As you all know, Sorgen is a company or a brand where we deal with compression socks and stockings right from the medical range to the sports and for everything in between for daily lifestyle and travel. Being a responsible healthcare company, we thought that we should, provide knowledge and scientific knowledge to our community for all the questions they might have regarding running. And our guest today is a renowned physiotherapist with over 16 years of hands-on clinical experience in orthopaedic, neurological, and sports rehabilitation. He began his professional physio journey at Saifee Hospital and has since built a strong reputation for working closely with athletes and even active individuals. He is the founder of Physioridham and the Foot Clinic and has successfully led a large team of physiotherapists delivering high-quality care. Known for his practical approach and deep understanding of movement and recovery, his work continues to impact performance, injury prevention, and long-term musculoskeletal health. Please join us in welcoming Dr. Harshad Padsala, the founder of Physioridham. Thank you so much, Dr. Harshad, for joining us today.
Thank you, ma'am. Thank you so much for inviting us here.
Yes, and we have another, renowned personality with us. Joining Dr. Harshad here, you can see a very pretty face with Dr. Harshad. She is a skilled musculoskeletal and sports physiotherapist known for her modern evidence-based approach to rehabilitation and performance care. She is also a certified Pilates practitioner with expertise in IASTM and myofascial release therapy, helping patients move better and recover much stronger. Please join us in welcoming Dr. Dhanushi Dhandhukiya. I hope I got it right, Dr. Dhanushi. And thank you so much, doctors, both of you, to give your time today for our running community. And of course, thank you to our running community here who's all set ears to listen to your expert, opinion and advice for them. They're gearing up for a race day, which is the Mumbai Marathon happening on 18th of January. And of course, it's not just one marathon, it's several marathons ahead. So welcome, Dr. Harshad and Dr. Dhanushi. Thank you for joining.
Thank you.
Yes. Doctor, in your extensive practice, I'm sure you would have seen so many runners as your, patients, and especially at this time of the year, especially this is the marathon season. So before we get into the specifics of a race day strategy, could you walk us through the ideal warm-up routine? Because we're talking of injury-free, and I'm sure, warming up is something which you would recommend. So what is the ideal warm-up routine that prepares a runner's body for demands of a marathon or any race?
Yeah. So basically, warm up is where the race starts actually. Okay.
Yes.
It's the warm up which is going to take you till the finish line.
Mm-hmm.
So an ideal warm up is very important, and warm up is done basically to raise the temperature of the body, to get you
Yes.
ready to move quickly, to mobilize your joints, to activate the muscles for running. So I always suggest people not to go for very heavy stretching in the warm ups, because there your idea is just to make the body little free. So I would suggest 5 to 10 minutes of easy jogging or brisk walk around.
Okay.
A little of hip drills like leg swinging, hip circles. You can do little walk lunges.
Okay.
You can do butt kicks. You can do high knees. You can do a little of small run around.
Okay.
1 to 2 minutes, short distance. Okay.
Mhm.
And little basic calf stretches.
Okay.
Go over and try touching your toes. Do
Okay.
little hamstring stretches by putting the leg over something and just with two hands just try touching the toes, but not heavy. Don't do
Okay.
very heavy stretches before the run,
Before the run.
because
So what is the
sometimes
ideal time? Yeah. What
So
is the
ideal time is
time?
5 to 10 minutes of warm up is very
5
important.
to 10 minutes.
5 to
Okay.
10 minutes. And
Okay.
majority of the warm up will be jogging, spot jogging, because that activates everything very quickly.
Okay. So,
So
doctor,
this is
sorry, please go ahead.
yeah. So this is a very ideal routine.
Ideal routine. But doctor, sometimes it's very crowded when it's a very large marathon. There's a lot of crowd. So what is the best way to warm up at the starting line when we are packed into a crowd and there's very little space to move? Is there some tip you can share here? Yeah.
So at the starting line, when the space is very limited, one can just focus on, activation and isometric preparation of muscles. You can perform simple exercises like ankle circles, heel raises, then single leg standing drills, buttock kicks, on the spot marching. You
Right.
can probably do calf pushes against an invisible wall. And you should keep your posture tall, cadence light. So, and focus, on breathing also.
Okay. All right.
So all this will help you get into the adaptation and prevent any risk of injuries. later
Right.
on.
So I think this is very useful because sometimes you want to warm up, but there's no space to do it. So this is really, really helpful.
That's very common. So we sometimes suggest people to just go a little early and do your warm up before the crowd starts mounting there.
True.
Then
So,
you
doctor,
get busy around socializing also, and you forget to do a warm up.
exactly. But I think the biggest tip from you here is not to forget the warm up, because that is, you said very rightly that your race begins at the warm up. So that
At
is
the
a very important takeaway point here. I think that's a pro tip here from an expert, sports physiotherapist like you. And how can we tell the difference, doctor, between a normal race day discomfort that many people experience and a serious injury, which means we should that they should stop running? So always there is a
normal-
slight pain. Yeah. How do we
Yeah,
tell
so
the
a
difference?
A normal discomfort is like diffuse little basic pain or basic soreness kind of thing while running, or which is slow, increasingly gradually, very gradual increasing of that, which is stopping your pace, reducing your pace, but not giving you much trouble. Okay, these are the things which is very usual. So once you start running, you sometimes feel that you are little tired, then you slow up, then again it heals up quickly in between. These are the normal race day things which you should not be worrying about. But something where you have to take a call will be like if you start getting tingling or numbness in your extremities.
Okay.
Okay, if you start getting tingling or numbness or pins and needles in your legs, or
Okay.
any part of the body, then you immediately need to stop and address it. If you start getting loss of the range of motion, like you're not just able to put your step forward,
Oh,
or
okay.
you are literally fighting with the pain, you should stop and seek the help of the medical professionals there, whether you can continue after doing their little treatment or little stretches and something. Seek a help. There will be physios on the race day. You
Right.
meet them because if your pain is it's a severe intense pain, you need to immediately show it to the medical person there. If they ask you to, if they find it that just muscular basic stuff, just move on or get some release done and get move on. But say suppose if there's a discoloration happening, like
Okay.
blue and blackening of the legs or anything, which can be a vessel related issue. You are finding breathlessness,
Right.
severe breathlessness, you need to immediately stop that.
Okay.
So
Okay.
these are the few things where you should be, you have to compulsory get rid of.
Seek
Majorly,
attention.
seek
Seek
attention.
advice.
Majorly, it's the numbness in the legs, pins and needles, and tingling.
Okay.
Yeah,
This
because
is
that
very
can be
important, doctor, because
related.
because there's that euphoria when you're running, and
You just want to finish your race.
and you feel that it's okay, it's something minor, but it shouldn't end up in something major. So these are the signs to look out for.
Yeah, this what happens. Every year you see these people who have severely fainted or to be taken to the hospital. So
Right.
because they have not listened to that body.
Okay.
You got
Understood.
it. So
Yeah,
nothing
so-
wrong in taking the help from the medical person there.
And then continue the race.
Then continue the race. If they are okay, then you continue your race.
So it's better to seek help and seek attention rather than
Immediate.
crossing the
continue
line
with-
and trying to finish it.
Yes.
That's really important. I hope everybody here has got that point, because I think this is really, really critical. It's a very thin line between discomfort and something which is critical.
Critical. Yes.
Yes. Okay. And doctor, if sometimes, like during mid race, sometimes runners do experience cramps during mid race. What is the effective way to handle this? Should it be stretched, or some different technique should be used, or how can you say help yourself in the mid race if a cramp is experienced?
So when you experience any cramp mid race, the
Yeah.
first aim is to get rid of the cramp and then return to the race. So what you can do is stop or slow down very gradually. You can massage that area, the affected muscle, and then probably have some electrolytes. You can
Okay.
also try, static brief stretching if that helps to ease out. But in case of multiple cramps, like, many joints, many muscles being affected, one should perform a controlled stretching, controlled contraction followed by relaxation. So in that, you perform isometric contraction, like, against a resistance and then release it. So this will help you get rid of the cramp.
Right.
Followed by, just relax for a while, breathe properly, consume certain electrolytes if needed, have some carbohydrates. And when you return to the race, make sure you are, starting at a slow pace and then gradually going back to your own speed.
So that's very helpful. Any particular way to massage the affected area? Is there?
Just you can press the muscle wherever you're feeling the contraction, like wherever the cramp is there, you can press it, hold it for 5 to 10 seconds, and then pump the muscle.
Okay.
So this is a very very unique technique. If you if you feel like any cramping in the muscles, even in normal case, you just squeeze that muscle, hold it for 5 to 10 seconds, strong squeezing, and just release it.
Okay.
Most of the time the cramp will disappear. Even some people get it in the night also. They can use this technique. Just hold it strongly, squeeze, and just leave it.
Release it. So then probably if they don't find relief using this technique, then it's
they will
better to seek the attention.
Yeah, seek the attention from the physios there or the medical
Physiotherapist
person there. Yeah.
Correct. Okay. Thank you so much for this, doctor. And sometimes later, in the later miles, there is some kind of a tiredness which sets in. Sometimes, they may collapse. Or what is one simple mental check that one can do, to reset posture?
Basically, what happens when you start running, you are well prepared and everything. But slowly, that gets little monotonous. Your posture, at certain mile, like say every mile, the ideal is every mile you'll have to check your posture whether you're running in a right posture.
Oh wow!
Sometimes, you see that people run with the forward stoop neck and all, this constant. You don't realize much because you got monotonous with that running. So every mile we suggest that you take few seconds and just correct your posture again as you are starting the race again.
Okay.
Then you're running only 1 mile. Okay. then it's not 21 or 42, and you're running only 1 mile. So every 1 mile you are checking your posture again, so that you correct the posture. And what are the checks that you should do is the tall
Right.
chest.
Okay.
So tall chest will help you breathing more air, because sometimes what we have seen why people get tired easily is they are forward stooped while running, and putting the chest in, which doesn't allow more oxygen. So you need to do the tall chest. First thing, do little deep breathing, activate your diaphragm, do little gluteal squeeze, buttock squeeze, activate your glutes, which will put your spine in straight line, and then you're again ready for the next mile.
Oh, fantastic,
Do
doctor.
it this way, then it will not make you much tired. People get tired because they are constantly in a wrong posture after 1 mile, 2 mile, 3 mile. Everybody tends to get in a little wrong posture.
Yeah.
So if they correct it, all these big athletes who are running the very professional runners, they are
Right.
all check it every mile. They are cautious about their posture. It's the right posture which will take you to the end. It will take you to the end with safest.
Okay. This is really important, doctor, because as you said, the oxygen also increases, and automatically you don't feel you're getting less tired. You are also,
And your core gets
taking care
engaged.
of your body, your posture, your spine, everything.
Yeah.
So this is really, really very, very helpful, doctor. And thank you so much for sharing these lovely tips with our community. And now that we spoke about posture, we spoke about cramps, there's something else which is really important, and that's the feet of the runners. A lot of runners feel that they feel that they seem to flatten out. Like those who don't have flat feet also feel that probably after some years of running or a lot of runs, they feel that their feet are flattening, or they lose the arc. As the race progresses also, this can happen. And what does this do actually? Why does this happen, and what does this do to the rest of the leg? If you can just help to understand this.
So foot flattening or drop in the medial arch
Yeah.
happens from runs. The drop is basically called the foot pronation. It happens
Okay.
because the intrinsic muscles of the feet, which we never train, gets tired.
Okay.
And there's reduced stability from tibialis posterior and hip stabilizers also. So
Okay.
as a result of the muscles getting tired, the pronation, that is flattening of feet, happens, and due to which there is tibial rotation, which it causes a lot of strain on the calf muscles, your knee, and your shin bone.
That's why
Right.
many runners get shin pain and all. So
Correct.
the common complaint that we get from the runners is shin
Shin.
pain. See what
Right.
happens if you are a runner from childhood,
Right.
your body is adapted to running. We are
Right.
grown with that. But most of the people who were running marathons nowadays have started at somewhere around 30s, and that 25, 30, 35, 40. So when
Right.
you start running at this age, what happens is your muscles in the feet, okay, the weak muscles of the feet, we always strengthen the bigger muscles like quads,
Correct.
hams, all the I'm pretty
Correct.
sure every runner is strengthening all these big muscles, but
Right.
nobody does the strengthening of the small muscles in the feet, which
Okay.
actually holds your arc. So when you start running at this age and you don't strengthen your feet muscles, they tend to drop, because it's a very repetitive activity, the
Right.
running, okay,
Right.
and it tends to fall your arc. We
Right.
don't realize it much, but it gives you shin pain, heel pain, plantar
Yes, a lot of
fasciitis
runners
pain,
experience. Yes.
medial compartment of the knee. This is very
Right.
common. The most commonest complaint of runner is the plantar fasciitis and the
Correct.
shin pain.
Correct.
So correcting that is very important, and this is the reason why they get it, is because of the weak muscles of the feet. Everybody needs to strengthen the muscles of the feet, which is below ankle.
So, doctor,
On
the strengthening of the feet muscles which you are suggesting has to be done how often, or what is the kind of routine for
So this should be an ongoing process. Okay. So a lot of single leg standing can help you. If you stand on
Okay.
single leg, if you
Yeah.
jump on single leg,
Oh.
then your feet muscle has to get activated. Because you
Oh.
cannot stand on a single leg with a weak feet muscle.
Right.
If somebody
Right.
wants to strengthen their arc, they need to start standing on one leg.
Okay. Wow.
Stand on one leg, and within no time your arc muscles will become stronger, because
Interesting.
your feet is forced to use their muscles.
Right.
Secondly, don't stand with a V feet, okay?
Right,
Stand with
right.
straight feet.
Great.
It has to be parallel to each other. Most of the
Right.
people nowadays stand like this here.
Yes.
Okay,
Yes.
with a V.
Yes.
The moment you're in a V, your arc starts dropping. The moment you are straight fitted or moment you are walking with the straight feet, your arc muscles are used.
Right. So along with posture correction and along with a lot of training for strengthening your whole body, I think there's a lot of mindfulness that one has to have on strengthening the feet muscles is what.
Feet muscle. This is the most used muscle in running.
Correct.
The
This is-
little change in the posture of the feet
Yes.
can really take a toll on the body if you are a runner.
Right. So even people, so if this happens to almost all runners, I mean, if this is common for runners, then people who have flat feet, it would be even more impactful for them, right?
Undoubtedly. Most of them realize after few runs, once they have gone to 2-3 doctors back to back again and again, same problem, they keep getting the problem again and again
Right.
after treatment. Then
Right.
that's where they understand that it was because of the flattening of the arc, and they get some arc support and everything, and then they are fine.
So no, what I was trying to ask you is people originally with flat feet, it will be worse for
They
them.
will get more problem. Yeah.
Yeah.
But many of them knows about that problem.
Right.
Problem with someone who doesn't know about
Who
it.
doesn't know?
Someone who is
Yes.
getting injury repeatedly, but
Right.
still don't know the cause of it.
Correct.
And
Correct.
most of the time, the cause is remaining in your feet, which is not falling right on the ground.
Right. So doctor, that means for someone
Right
who's
loading of feet is
currently-
very important.
Yeah, so for someone who's currently, who's not feeling any pain in the feet, is it still important to get a professional gait or a foot scan done so to know where you're starting off with and what correction is required?
See, basically, running a marathon looks very easy, okay?
Yeah,
But it's extreme sports. Marathon running is an extreme sports. You
Right.
need strong training for it. Okay, you might not be facing any problem right now, but it's a overuse sports.
correct.
And in any overuse sports, you have to be very preventive about not getting injuries. So if you get, because people tend to get flat feet if you are a long runner.
Yes.
So if you get a foot scan done, if you get foot analysis done,
Right.
see, there's nothing wrong in getting it done and checking
Yes,
whether you are
yes.
prone to getting the flat foot or not.
Correct.
Are you getting it right now? Is it pronating any degree? If you need
Right.
some correction, you do some exercises that you will come to know. You can prevent your injuries if you get a foot check done. According to
Right.
me, so in US and all, a foot check is compulsory for any athlete of any sport.
Right.
So in a school, you need that fitness certificate, right?
Yes.
As the
Yes. So
same
even
way
the
you need
strength-
the certificate for your foot scan.
Correct. And on the basis of this report, one can then, talk to the doctor and fix the, routine for the strengthening of the feet muscles then. So what
One
are
more
the
thing I
steps?
wanted to add here, little thing. Indian Army,
Yes.
it's compulsory to check your feet. If you are
Wow.
a little flat feet or pronated feet, you are not taken in the army.
Oh, really?
That is the importance.
Oh, wow.
That is
Wow.
the importance of it.
Wow. So then if you have a flat feet and you want to take up running, then the answer is to do the strengthening routine for the feet, guided
Yes.
by the sports physiotherapist.
Physical therapist.
Yes. Okay. So which we can know only after the scan.
Yeah, after the scan.
Great. Thank you so
Sometimes
much.
every time you're looking at the feet, it might not look like a flat feet. But see, pronated foot is very common rather than flat feet.
Right.
Most of the people are pronated. Pronated means your arc, which was 6 degree, has become
It's
2
dropping.
degree.
Yeah.
It's dropping. You will still see a arc, but it was 6 degree, which has become 3 degree now.
Right.
So
Right.
that's the problem, which alters your posture.
So it is important for runners to know the status of their feet so that they can
Oh,
plan the
that's-
strength training accordingly as they progress with
yes.
their.
Yeah, that's very important.
That's interesting. Thank you so much, doctor. And is there any specific muscle group that most runners forget to activate before they start, which could lead them, to a trouble during mid-race?
Most runners which forget to activate is the gluteal complex. So
Okay.
basically what happens if the gluteal muscles are weak or inactive, it leads to poor
Right.
hip control while running. So it
Okay.
can lead to internal rotation of the hip, that is the hip getting turned inwards, or adduction of the thigh, that is your thigh moving little inwards. So
Okay.
as a result of which your quadriceps, your IT band and your calf, they are overloaded and they're
Okay.
overworked.
So that's why IT band IT bands are very common. IT band pain and injuries are very common in runners actually.
Mm-hmm.
Very common.
So one
Yeah.
should properly warm up, like there are certain exercises for gluteal muscle warm up, like single leg bridging.
Yes.
Then in standing you can do hip extension, that is like taking your leg back. Then
Okay.
tie a TheraBand around your thighs and laterally walk, like side to side walking, clamshells. You should include at least 2 to 3 sets in the warm up for gluteal muscles.
Oh, in the warm up itself, and also in the routine strength training, this should be incorporated.
Yes, definitely.
Okay.
What we've
Thank
seen is many people on the name of glutes keep strengthening their lower back. So you need to learn the exercises under some sports physio and then keep doing at home.
Okay.
Because sometimes you're looking at a video and doing some exercises, but
Yes.
you're not actually activating certain group of muscles.
Yeah, not engaging those kind of muscles which are
Yeah,
needed.
you're not engaging those guys. So you just
Right.
learn it once very well, understand the muscles, and then you can keep going on your own.
Okay. Thank you so much. And Dr. Padsala, we often hear runners complain about calf pain, soreness, making their legs feel like lead towards the end of the race. Could you explain what's actually happening here in the muscles and how we can help the body, clear that heaviness more effectively?
See, the commonest problem for most of the runner is the calf buildup. Okay, the pain in the calf, the tightness in the calf, cramping of the
Yes.
calf. The
Correct.
most common is muscle, because
Yeah.
it's the most used muscle in running,
Yes,
especially
yes.
marathon running.
Yes, yes.
Okay, because it's your calf which is taking you till the end.
Correct.
So what happens is eventually, slowly, the calf starts getting in the buildup of lactic acid.
Yes.
The lactic acid then doesn't allow the blood flow to, it restricts the blood flow in the muscle, giving you cramp, because you are constantly using it with a restricted blood flow, and that is
Right.
giving you cramping in the calf, severe cramping, and at a point where you just can't move ahead. So there are few things that you can do there. One is self massaging of the calf. Say suppose
Right.
there is no help there, and you just can do little of self massage.
Right.
If you can do little of calf stretches then
Right.
and there, okay. You can do little squatting then and there. Just
Okay.
squat for 30 seconds. Yeah. Full Indian squat for 30
Okay.
seconds. It's a good stretch for the calf muscle. Okay. If you don't have anything else. And
Right.
if you are getting all these problems regularly, say every run you are getting this trouble, then
Yes.
you have probably weak venous insufficiency.
Yes.
So you can start using compression stockings for this. There is
Correct.
calf sleeves available. You can
Correct.
use calf sleeves, which is like a constant massager. See, a
Correct.
compression stocking is a constant massager to your calf. So every
Right.
time your calf contracts and expands and then relax, this is going to put pressure on it. It doesn't help the
Right.
it helps in not getting the lactic acid deposit
Correct.
happen.
Correct.
Doesn't let the swelling happen in the calf.
Yes. It helps to reduce the lactic acid buildup in the calf muscles.
So you can
Compression.
use the calf sleeve, or you can use the below knee stocking, which is a
Correct.
full sock until the ankle.
Yes.
Okay, which helps you in plantar fasciitis, your heel pain, and also your calf buildup.
Right. Right.
So this helps you in compression stocking. Always helps you in recovering the muscle quickly from the
Right.
burnout.
Right. In fact, talking of recovery, there are studies which also say that apart from the benefit of reducing the lactic acid buildup and reducing the soreness, it helps a great deal, for recovery. So post the race also, there was a study which said that if you continue to wear the compression socks or the calf sleeves, it will, help you for the recovery as well, much better than if you hadn't worn them.
Yeah, it's for years. It's the RICE protocol. Rest, tight,
Right.
elevation, and compression.
Correct. Correct.
And wearing the sleeve is the best way of compressing it.
Correct.
Because you
Correct.
can't keep tying the bandages for a long time, and
Absolutely.
you don't know how to
Absolutely.
tie them very well, and it's a task.
Absolutely.
Wearing a sleeve is very easy.
Right. So definitely compression has its benefits of, helping more of the oxygen flow, reducing the lactic acid buildup, and also the micro oscillations which happen while running. So the wear and tear is less for the muscles. So overall recovery is much, much better.
Quicker.
And doctor, my next question would be, what is the biggest mistake that runners make in the first 30 minutes after crossing the finish line?
So after crossing the finish line, what most runners do is, stopping immediately.
Right.
They just lie down or sit very coldly. So
Right.
as a result of this, the venous return is, restricted. There's pooling of blood and
Right.
leads to stiffness of muscles and cramps and all that.
Correct.
Reduces the recovery. Instead, they should walk at a light pace,
Okay.
compression socks, Gentle
Right.
stretch or
Right.
twist.
Do your cool down activities.
So, like a small cool down, like how we had a warm
It's a
up,
must.
the cool down
It's a
is,
must.
yeah,
So
I
basically,
think,
what happens when your muscles were used for like say 1 hour, 2 hours,
yeah,
okay, they have got that hypertone now.
right,
Why cool down is very important is because you need to rest down this hypertone of the muscle because it keeps using your energy. Any
right,
muscle which is hypertoned right now, say you go to a gym, you have bulked up your muscles. Now
correct,
you want them to relax also. If they
right,
not relax, they will keep building the lactic acid within them, and they
right.
will eventually start giving you pain. So your cool down immediately starts as your run is finished. You need to calm down your muscle. Tell them that now the race is over. Now they need
Right.
to relax.
Okay. So, what is the duration that you suggest for this cool down? Like a slow run or
Yeah,
keep
same like warm up, 10 to 15 minutes.
Okay. So, one is to keep the compression socks or calf sleeves
Yes,
on
yes.
and continue to do
That's a constant cool down.
correct.
If
And
you're wearing a compression stocking, it's a constant cool down that you're
constant
doing.
cool down and a slow walk or a small
So walk, little mild stretching, gentle stretching. You can do icing, ice bath.
yes.
These are the things you do for recovery and cool down.
And definitely don't put a hard stop after the run is
Yeah,
what
yeah, yeah, yeah. No hard stop. You have to
correct.
walk a little
Correct. Correct.
because your heart also suddenly cannot reduce the
Yes.
rate.
Correct.
You are at a higher rate, 120, 130, and from there
Right.
suddenly you just cannot be at 70, 75.
Right.
You'll have to gradually get it down slowly.
Right. So I'll just take a moment here and tell all our listeners here that we will be unmuting everybody for questions one by one after we complete the webinar, which is in the next 5-7 minutes. We have only 2-3 questions, and then everybody can think about their questions or put it in the chat box, and we can unmute you and you can ask your questions after this. So, doctor, the next question would be, why do some people feel some phantom pains or strange stiffness, a feeling of strange stiffness during the taper week when they're actually running lesser than before?
See, any activity that you start, like a gym goer who goes to the gym every day and suddenly reduces going to the gym. Now your body is used to being in that energy level. Your body is used to, your heart and everything is used to being in those levels. Okay, like this is like somebody getting a lot of money every day and then suddenly there is a crisis.
Yeah.
So somebody who is using the body, regular runner and all, they need that run. Your steroid gets boosted only with that run.
Right.
So what happens is at that moment, when you're reduced running, your cortisone level also, body feels that there is no run, lesser cortisones are secreted in the body.
Okay. Yes.
Okay, and that gives you like little, phantom pain. You don't feel like that energy levels and everything. So phantom pains are happening because of the sudden tapering of them. So if you are going very gradual tapering, you will not see much of the phantom pain.
Okay.
So people who are training for the initial days or first year of their run and all, they get this. But many years runners, they get rid of the phantom pain because they are used to it. They
So
taper it at a gradual rate.
Yeah. Any tips or suggestions if one experiences these phantom pains?
There cannot be a sudden tapering. You'll have to plan your tapering.
Okay, the tapering has to be planned in a more gradual manner.
Yeah, and you'll have to understand this. This is a lot of psychological stuff that this is going to happen.
Right.
You are going to have this thing and all. So you have to be ready for it.
Correct.
Yeah.
Thank you. And I think we spoke about the cool down. So I'm going to skip this question because I think we discussed about the cool down. You discussed about ice bath. You discussed about rice. Yeah. So at Sorgen, we do have a cold compression, which is ice along with compression, which helps. So we have that for the calf, for the ankle, and for the knee. So we've covered the cooling down. And my last question for the day would be, once the race is over, this is a lot of runners have asked us this question to ask you here on the webinar is, once the race day is over, how many days should they wait for the first test run? And what should they do for the recovery in between that period?
So basically, after the race is over, you need to really give time to your body. Okay, now the race is over. So according to me, it ranges, it varies from people to people, okay? But minimum 3 days to 7 days.
Okay.
So I would not suggest a run for 3 to 7 days. You can do little walking, you can do little warm-up things, and you can do little stretches every day. You can go for bath, sauna bath. You can go for ice bath. You can take magnesium for recovery. You
Okay.
can wear the stockings and everything. Okay.
Mhm.
But 1 week of no heavy running, 1 week of no next run, no marathon for 1 week.
Okay.
3 days to 7 days. That is
Okay.
very ideal time that you should be resting the body, enough sleep that you need because of the
Right.
anxiety of marathon. I've seen many runners who don't
Uh-huh.
get sleep on the previous night.
Right.
So that
Right.
anxiety and all.
Also, you have to get up
They're
so
hardly
early and
sleeping for,
reach.
yeah.
Yeah.
So a lot of hydration, like coconut water, and which can recover your magnesium, and a lot of sleep.
Okay.
Give yourself that time, then and sleep. Take enough rest.
All right.
Then you will recover quickly from your marathon.
And then you're ready for the next race.
Then you're ready for the next one.
Yes. Thank you so much, Dr. Dhanushi and Dr. Harshad, for your time to, give your lovely tips and very, very useful tips to our community here, to the Sorgen running community. And we can ask questions now. So if there are any questions, I think we have some in the chat box here. So if there are any questions, you can unmute and ask. There is a question from Deepak Agarwal. Deepak, if you're there in the room, we can unmute you. Yeah, Deepak.
Hey, hi team. Am I audible?
Yes.
Yeah, you're audible.
Okay. Yeah, so a quick question was there, like after our long runs, maybe 30 plus, or after finishing our full marathon, so for around 2 or 3 days, like there is a pain in hip flexors and maybe like the crest of that bone, and like there is not much we can do. The massages don't work, the stretches don't work, and we need to bear that pain. So, like, is there anything advice from your side for our runners?
So icing would help you a lot for that. Okay, compression icing. You can do compression icing. Somebody needs to really hold it tight there, 7 to 10 minutes max, not more than that.
Okay.
And stretching that area, stretching the hip flexors.
Okay.
You need to learn the hip flexor stretching very well, and that will help you best for this.
Okay.
It's very common thing because most of the time the runner, and you can avoid this by checking your posture. As I told you, every mile you need to check your posture. So ma'am, this is what the problem that people get. If your posture is forward stoop while running, which is
Right.
the runner, so every 1 mile you need to check that you are not forward stooping.
Correct.
If you're forward stooping, your hip flexors are under constant compression.
Right.
Okay, the constant loading of the hip flexor and the gluteal. So hip flexor and gluteal, they work against each other. If the hip flexor is contracting, glute is supposed to relax. And
Right.
while running, you cannot have a relaxation of the glutes. So
Right.
you need to every 1 mile check that you are not forward stooping. You are always straight with the diaphragm which is activated, chest which is out, glute which is contracting. Because it's your glute which you are using for the running. So
Right.
forward
Okay,
stooping, if you stop forward stooping, this problem will disappear. You'll not get
Okay, so like we don't need to bend from our waist, like just
you
from
don't
our-
have to bend from your waist. So every
Okay, now-
1 mile, you will tend to bend, but every 1 mile you have to check.
Okay. And one quick question on that, like, does it has anything to do with landing of feet? Like maybe if we are healer, if we land on
Yeah,
our
that's
heel.
what I told you. If your feet is landing with an external rotation, if your feet is landing with an external rotation, you will tend to get this problem. If you're running with a straight feet, okay, but don't try to change anything now.
In race, yeah, it's not possible.
For this marathon, don't try to change anything. Run the way you have been running and you have been trained. Later on, after this marathon is over,
easy
then
runs.
you can try make changes in your gait and running.
Deepak, are you running the
Try running
TMR?
with a straight.
Yeah, full marathon.
You're running the
Very
full
good.
marathon. Okay.
Very
So
good.
Actually, I've just started running in June, and I did my first marathon in December, Pune International Marathon, full marathon. So this is my second full marathon now.
No, you this is the right question. Then you asked.
Yeah.
I expect this from the people who started running this year.
Right. Like after my first marathon, I got this issue in
First
my
year
leg.
is learning.
Yes, definitely. Yes.
But we congratulate and all the best for this run.
Yes, thank you so
wish
much.
you all the very best. We have a very renowned surgeon here, Dr. P.C. Gupta. We are so happy to have you here, sir. He's a renowned vascular surgeon from Hyderabad. And Dr. P.C. Gupta is also asking a question. So
Yes,
please
sir.
go ahead.
Hi Achal, good to see you.
Good to
Hi.
see you too. Yeah.
Thank you for organizing this.
Thank you for being joining
Thanks,
us
Harshad. I
today.
think a lot of important tips given. I think just a little more information on how we sort of maintain the foot arches, and also a few tips on running uphill and downhill. Hyderabad has a lot of uphill and downhill running.
Right.
So this is so when people here also Satara and Lonavala runs, okay, there is a lot of uphill and downhill. So people who have flattening of the arc, okay, tend to have a very tight calf muscle. If you check, if you are a flattened feet and you cannot squat fully, you can't go into Indian squats. Your heel will raise because you have very tight calf. But for an inclined run, you need a flexible calf. You cannot have a tight calf which is restricting your ankle at right angle. You need to have full flexibility of the ankle and the calf to stretch to its maximum to run a uphill.
Okay.
So what happens is most of the people who have very tight calf muscle and running uphill tend to get injury. If you're going uphill and going downhill, you need to have a very strong tibialis anterior muscle which is in front of the shin bone, shin muscle. Tibialis anterior is front of the shin. It has to be very strong to run a downhill because you are controlling it. Downhill you are controlling your body, uphill you are pushing the body.
So should we really run fast downhill, or should we sort of run in a very controlled manner?
You will have to run on a very controlled manner in both the ways. Because if you go with a pace, there are chances that you might lose a balance while going downhills. Okay, because gravity is helping you. It's not only your body. It's the gravity also which is also helping you going down. So you will have to control the gravity also to modulate your pace. So going at slower pace in both of them is very ideal.
Yeah, thanks a lot, Harshad.
Thank you, sir.
Thank you,
sir.
Dr. Gupta, for joining us. And Dr. Gupta has been recommending compression stockings from years. And I think now the use of compression socks and stockings in sports is something which...
yeah, this is like you see.
It's really taken off quite well.
Every sport.
Yes. Thank you so much, Doctor, for joining us.
Thank you, Harshad.
Do we have any more questions? I had seen somebody raising their hand. Naitik, you can please unmute yourself.
Yes, am I audible?
Yes,
Yeah.
very good. You can even start your video if we would love to see you and you can ask your questions. Yes. Yes, Naitik, please go ahead.
So my question is regarding the recovery run. So after completing my runs, in how many days I should do recovery run?
3 to 7 days, depending on how long you have been running and how. So it's very different from people to people. People who are a regular runner for years now, they recover within 3 to 4 days. Okay, because they know everything in and out very well, what to do. They've run also in a very nice way. They are trained. They're not tired much. They are fine. People who are running since like 1 year or something, they need at least 6 to 7 days for the next recovery run.
What should be the duration of that particular?
So you can start with your 4 to 5 kilometer, okay, and then see again your body will tell you. Your body will tell you. If you feel fine, you can go on. If you are feeling that you're still recovering, you can just slow down, go for 3 to 4, 5 kilometers. You can go for mild jogging or little brisk walking initially for in the 4th or 5th day after post run, and then after 1 week you can start with 4 or 5 kilometers and then go on. So as you will progress with running with years, you will understand your body very well. And then you know exactly how many days post run you need to start. But ideally 3 to 7 days.
And one last question, since I am new to this running, so for knowledge I am asking this.
Yeah.
What is the importance of the recovery run? So why should we do that?
Recovery run is very important because if you are planning to do this sport for longer run in your life, okay, then you cannot stop it. Because again you will be starting from basics. Somebody who stops running, that's why recovery run is very important. Okay, you need to continue this sport to get your body being used to this and making it more easier for you every time. See how these regular runners, they just finish it like this and hardly anything happens to them because they have been, they're not stopping it in between. If you're looking for a long-term thing, then that's why recovery run are important. So you don't want the body to completely cool down and start again for the next race. Again you have to start from beginning. So that's why recovery run, it's like a normal stuff. You have to keep going. After your vacation, you are back to your business in the same way. 3 to 7 days vacation and then you are back to running.
Okay, and that's why the regular runners are often participating in the long distance run.
Yeah, that's why they can do it. They do 6 to 7 marathons a year.
Yeah.
COVID and all, because they don't stop it.
Yeah.
They just don't. Recovery 6. That's why we have recovery time also, no? Because recovery time and then you need to start. That's why that time is there. 3 to 7 days, then you start again.
Correct. Got it. Thank you so much.
Thank you.
Does that answer your question, Nitik?
Yeah, fine.
Okay, great. Thank you so much. And do we have any other questions? We had a question in our registration form. I don't know if the person is here, but he had asked that he is getting shoulder pain. His shoulders pain after the race. So
there are many people who have shoulder pain.
Yes.
And that is because of the forward stooping.
Okay.
If you are running with a forward stoop shoulder, you tend to, and you have a very stiff neck and trapezius and all, you are injuring them while running. See, while running, you are getting a constant thrust from the ground, which is passing to your cervical.
Right.
Your head is constantly, working. If you are stiff neck, that's why in warm up, you also like ongoing training, you also need to be careful about the posture.
Correct.
It always again comes to the posture.
Right.
Your posture, like everything, running is not only leg activity.
Yeah.
It's your head, it's your arm swinging by side, everything has to be coordinated very well. If that coordination is not there, and then you can get injury anywhere. People get migraine also because of this.
Really?
Yeah, stimulation of the migraine. Because the fascia here gets very tight and they start having headache. Within the race, people start having headache. The most common thing we see on the race day is the headache that they start getting.
And it's due to posture.
Because of the posture. Because of the posture. See, here you are not just sitting with forward stoop. You are running with a forward stoop.
Correct.
Then you are jerking it so much.
Yes, there's constant.
Every 1 mile, you need to get back to your chest upright.
Right.
Which will, let your brain also have enough oxygen. Because the oxygen is being used by your calf and hip and all.
Correct.
You need more oxygen for your brain also to function very well.
I think this is very well explained. The importance of posture has never been, emphasized the way you're emphasizing today.
I tell it every mile. Every mile.
Wow. Lovely. Thank you. Mr. Pradeep has a question. Mr. Pradeep, you can please unmute and you can start your video and please ask your question. Mr. Pradeep, you're here. You've raised your hand. Mr. Pradeep Bhamre, are you there?
I think he is not unmuted.
Yeah, he's not unmuted, but he's raised his hand and he wishes to ask a question. Okay. Thank you, Deepak, for your comment. Okay, Mr. Pradeep, you can unmute and ask your question, please. Or is there anyone else while Mr. Pradeep is preparing to unmute? Is there anyone else who has a question for Dr. Harshad? We are very fortunate to have Dr. Harshad and Dr. Dhanushi here to, give us great insights and answer your questions. So if there's any, please ask now. Physioridham is based out of Mumbai. They are at Churni Road and they'll be happy to, provide any consultation if it's required.
And we also have digital foot scanning facilities at our foot clinic. We run a specialty foot clinic where we make customized insole footwear, but we, on top of that, train the people for strengthening their arch muscles.
Fantastic. That is most necessary.
Exercising.
Correct. Mr. Pradeep, if you're not in here, then I think we will skip that. And any other questions from anybody before we close for the day? Doctor, on a parting note, what is your... Okay, wait, we have something in the chat box from... Yes. Hi.
Abhijit here.
Yeah.
So I have... Hi.
Hi. You can even start your video if you'd like to ask a question.
No, actually I'm in office.
No worries. Please go ahead and ask your question. Yes.
Yeah, I have two questions. One is regarding the foot scan. So where we can do this? If doctor,
so you are in which city? You are from which city?
Mumbai.
So you can do it at Opera House at our clinic. We are at Opera House. You can find Foot Clinic Mumbai on the Google. Foot Clinic Mumbai.
Dr.
Okay.
Dhanushi, if it's
Fine.
possible for you to write on the chat a contact number for right now. Otherwise, we will anyway put it up. We'll anyway send them. But if you can put it in the chat, it will be easy for them to get the contact details.
Yeah, definitely. And you have one more question.
The second question is, I don't know, means it's related to the psychology or the related to the posture. So I did 25 kilometer Tata Steel Marathon last week. When I just crossed 22 kilometer. So last 2 to 3 kilometer, it was like I was not able to run. Though I have the energy, but it was feeling like my knees are freeze.
Oh,
So I have to walk or means slow run. I have to do that, and after that I completed this thing. Means this happened every time, huh? In marathon also, in 10 kilometer also. After 9 kilometer, it feels like means 10 kilometer kabhi aayega.
I think this is so it is as you are saying. So if you are getting the same problem in 10 kilometers also, then it's a lot of psychological stuff. Okay, sometimes when we are thinking of the finish line, we are just thinking of everything, and this becomes a mental process. You can either seek a help of a sports psychologist. Okay, this is why that entire field has come up, sports psychology.
okay.
This is sometimes you get performance anxiety towards the end, and your body starts giving up, and you just can't finish the run. But I would suggest
Yes.
you to meet some sports psychologist, take some help from a sports psychologist, and they can fix this issue for you. There are few mindsets that they'll help you with, that what mindset you should have towards the end, or you between the run, or when you start.
Mhm.
It's all different.
Okay.
When you start, while you're running, and towards the finishing line. In
Sure.
every sport, towards the finishing line, the mindset gets very difficult.
Yeah,
So
and I
try-
think means
Try seeking help
earlier
from
also.
some sports psychologist.
Sure. Means earlier also for the question you said the foot means who is the regular runner, they finish like this only, means in snap only.
They are
And
basically
also-
not, they are not thinking of it.
Yeah, and also their photographs are very good, means
Yeah.
if you see they are always
just
smiling.
not, they are not thinking about the finished line. Ideally, they are very well trained for it. So they know very well when they are supposed to pace. They know very well when they are supposed to rest, when they are supposed to stop, how they are supposed to warm up in between, how they are supposed to do little exercises in between. They know everything. That will come with the training. As you'll get trained, now once you find the answer for this your problem, and then in next run you are fine. You will not get any trouble.
Okay.
The way you are mentioning
Thank
it
you.
is not the physical issue.
Okay.
Because if
Thank
it is
you,
a physical issue, it would not happen in 10 kilometers.
Yeah, sure.
Yeah.
Okay. Thank you.
So get some help from sports psychologist.
Sure.
Hope that answers your question.
Yes, ma'am. Yeah.
Okay. Thank you for joining us today. And I don't know if Mr. Pradeep is back. Otherwise, do we have any other question before we close? All right, Dr. Harshad and Dr. Dhanushi, one last tip before you say goodbye to our community.
No, we would just we encourage a lot of running from people, because the running is the activity that is going to keep you fit,
Right.
rather than walking. Okay. So running gives you strength in the bones. Running can really take care of your osteoporosis and everything. So keep running. That's the only, and we are right here to help you for any kind of trouble that you face. But we will ask you to keep running. And all the best to people who are running the Tata Mumbai Marathon.
Right. Thank you so much, Dr. Harshad and Dr. Dhanushi, for your valuable time. And all the best to all the people who joined us today and who will be viewing this later on YouTube as well. And best wishes not only for the first marathon of this year, the Tata Mumbai Marathon, but of course for all the marathons that you will run this year. Thank you so much.
Thank you.
Thank you.
Thank you, ma'am.
Thank
Thank
you.
you. Bye.
Bye. Thank you.